Hi guys, welcome back. In this video we shall be talking about sugar and diabetes. What is the relation of taking sugar, high amount of sugar and diabetes? Before we start, I want to tell you that the sugar that I'm talking about is simple refined sugar. That is a white sugar that you can find in your kitchen, that you find in your soft drink, that you find in your chocolates, that you find in your pastries, biscuit, right? So that your packet juice, your fruit juice, those sugar I'm talking about. So the question arises here is that if you take large amount of sugar, will you get diabetes? The answer is no, but there is a catch to it. You have to understand that if you're taking large amount of sugar, you're not going to get diabetes. That is sure, okay? But if you're taking large amount of sugar, you will be obese, you will be gaining weight, and gaining weight and obesity and overweight are the risk factor of development of diabetes mellitus. So in diabetes mellitus we have variety of diabetes mellitus. We have type 1 diabetes mellitus, type 2 diabetes mellitus, type 1.5 diabetes mellitus. We have drug induced diabetes mellitus, we have gestational diabetes mellitus. So mostly we are talking about this type 1 and type 2. The most common type of diabetes mellitus is type 2 diabetes mellitus, which is around 90% of 90% of the types of 90% accounts for type 2 diabetes mellitus. That is, type 2 diabetes mellitus is very common, right? And type 1 is also common, but comparing type 2 is 90%, type 1 is around 10%, and other diabetes it accounts for that. But 90% is type 2 diabetes mellitus. Now, in very short, if you have to understand what is type 1 and type 2 diabetes mellitus, very simple answer. Type 1 diabetes mellitus, there will be no insulin. Type 2 diabetes mellitus, there will be insulin, but the insulin is not working. Type 1 diabetes mellitus, there is auto antibodies against the beta cells of the pancreas. Type 2, no, there is no antibodies. Type 1, the primary treatment is insulin therapy. Type 2 diabetes mellitus, the primary treatment is oral hypoglycemic drugs, lifestyle modification, and later stages of life, then also you have to use insulin therapy. So in type 1, what is happening is that you are not producing insulin. So whatever sugar that you're taking, whatever carbohydrate that you're taking, it is going into your stomach, getting digested, and it is going to the bloodstream, but it is not entering the blood, entering this muscle cell or the adipose tissue. We want the sugar to be inside of the cell or the like muscle, primarily muscle cell and adipose tissue. Yes, also we want some amount of sugar in the bloodstream, but not in large amount or not in less amount. If there is large amount of blood sugar in your bloodstream, slowly your blood vessels are going to be damaged. And if you're having very less amount of sugar in your bloodstream, that is more dangerous. That is known as hypoglycemic attack. You will be unconscious, you may even die also. So we will never want you to go in hypoglycemic attack. Rather, okay, you can stay in high amount of sugar, but still it is bad, but it will kill you slowly. But if you're having low amount of blood sugar, it will kill you immediately. That's the problem about low amount of blood sugar in the blood vessel. Remember, whenever we are talking about blood sugar level, we are actually measuring the sugar that is present in your bloodstream, in your blood. We are never measuring the blood sugar that is present inside your cell. We can't do it, right? So so the insulin that has been produced by the beta cells of the pancreas, the function of the insulin is to make sure the sugar that is present inside your bloodstream to enter the cell, primarily your adipose tissue, that is your fat, and your muscle tissue, so that the muscles will so that the tissue will get energy, right? The tissue has to survive, it has to work. In order to get energy, this energy is got by the carbohydrates, right? So the question arises here, if I'm taking large amount of sugar, will I get diabetes? No, you will not get. But you have to understand, if I'm taking large amount of sugar, large amount of carbohydrates, I'm saying carbohydrate, what I mean is by the simple sugar, okay? Simple table sugar, white sugar, that's white sugar. If I'm taking that, I'll gain weight and my stomach will become big, I'll be overweight, and then I'll go to obesity, and that will put me in risk of developing type 2 diabetes mellitus. So yes, high amount of sugar, you'll become overweight, obese, and then you'll be in high risk of type 2 diabetes mellitus. But just taking sugar will not directly put you in diabetes mellitus, because generally type 2 diabetes mellitus is seen in people who are obese, who are overweight. But at the same time, you can find some people who are lean and thin also, but still they're having type 2 diabetes mellitus, a bit less common, but yes, you can find it. So it does not mean that if you drink a soft drink, you drink chocolate, you have chocolate, you take biscuit, you take pastries, you take cake, you take the packet juice, fruit juice, you'll not directly have diabetes mellitus. It will take you some time. So the idea is that you can take, but try to limit that as much as possible. You need to cut down your refined sugar, cut down it as much as you can. Yes, now comparing your table sugar and the sugar that you can get from your apple, both are different, because the sugar that you get from apple, that is also containing fibers in it. So whenever you take that apple, your blood sugar will increase slowly and it will be reduced slowly by the insulin. So what happens when I take sugar, my blood sugar level will go up. In order to combat that, the sugar that is present inside the blood vessel, it has to enter the cell. So my body is going to release, the pancreas is going to release insulin, which is going to make sure the sugar that is present inside the bloodstream to enter the cell. Right now, if I plot this in a graph, I can see once I take sugar, my blood sugar level goes up, then the body senses it, it releases insulin, and it is going to go down. So you can see a spike. Now the problem here arises that we don't want this spike to occur, because if there's more of the spikes are there, it is more detrimental for your body. Your blood vessels are jeopardized in this. So you don't want your body sugar to go up very fast and go down very slow, very fast, right? So we want to take those kinds of sugar that is not going to cause the insulin to go up sugar to go up very fast, come down very slow. So those are known as low glycemic index food. Comparing honey and table sugars. Honey is also sugar. It is also containing high amount of sugar, okay? But at the same time, it is going to increase the blood sugar. No doubt, it is going to increase. So do not think honey is very, very good. Yes, it is good. But you have to understand it is containing some micronutrients which are good, some antioxidants, but it is primarily sugar. So if you take a lot of honey, still you're going to go overweight. Your blood sugar is going to go up. But as comparing to table sugar, it will go up slowly. So honey is a kind of better as compared to table sugar, but still it's not very good. It's not very good that you can just take as much as you want. So limit the intake of honey as well. But in very short, if I can say, try to avoid the table sugar as much as possible, because not just about diabetes mellitus. Okay, if just like about yesterday I had a glass of soft drink, which I should not have, but I had. You have to understand, sometimes you can have, but try to limit it. Yesterday I know it was not right, but I did had it, right? So I should cut down it. So we have some ambitions. We are human beings. We can't be like robots, no? If you do this, don't do it, or do this. Of course, you have sometimes you can be relaxed a bit. Sometimes, remember when I say sometimes means actually sometimes. This sometimes should not come in like 2-3 days in a week. No, it should be like around once or twice in a month. Okay, even better if you can cut it down. Absolutely, if you can cut it down, it's much better. But again, high amount of sugar, overweight, obesity, and then type 2 diabetes mellitus. Remember, when you have diabetes mellitus, there's a high chance that you will develop hypertension. Or if you are having hypertension, that is high blood pressure, then also you can have type 2 diabetes mellitus. So diabetes mellitus is very bad. Hypertension is very bad. But if you combine this, it is worst. And the bad thing about this, if you don't control your blood pressure properly, you'll get diabetes mellitus. And if you don't control your blood pressure properly, you'll get hypertension. So if both of these things combine, very bad, right? So basic idea about how can you avoid type 2 diabetes mellitus. Mostly we're talking about type 2 because it's very common, right? So talk about something that is very common. See, type 2 diabetes mellitus is not very easy to avoid because it has a very strong relationship with your genetic factors. Family history. That is, if your parents are having it, it's a high chance that you will have it. But yes, you can do some things in order to reduce the chances of developing type 2 diabetes mellitus. Or even if you develop type 2 diabetes mellitus, you can do a lot of things in order to keep that under check. I'm sorry to say this, but India is considered as the the capital of diabetes mellitus. So rather nowadays you can see it is told that please control your diabetes mellitus, because sometimes it is very difficult in order to avoid diabetes mellitus. So how do you control diabetes mellitus? Imagine I had a blood test and I see, okay, my blood sugar is elevated. So immediately you have to start on with the medication. You have to start with walking. You have to start with walking. Lifestyle modification is very, very important. You have to start to walk. Please do not run, okay? If you are running and you are having diabetes for a long time, you might be having some issue with the heart. It can jeopardize your heart, right? It can put more pressure into your heart and you can go in some serious complications. So start to work, reduce your weight, stop taking sugar, because if I'm not having diabetes mellitus and I'm taking sugar, it will make me overweight, will make me obese, and then I'll have risk of type 2 diabetes mellitus. But if I'm having type 2 diabetes mellitus and I take sugar, it is going to make the condition worst. Okay, so we don't want to take sugar unnecessarily. Again, sugar, what we're talking about is the sugar that is coming from a table, kitchen table. That is a simple white sugar. That is sugar that is coming from your the fruit juice, right? The fruit juice, not the real fruit juice. If you take mango, make a juice out of it, that is the real juice, right? That is not going to do so much of harm as compared to this, because it's natural sugar and is containing fibers in it. But even that, if you're taking just natural sugar, do not think it's not going to harm you. Yes, less harm as compared to table sugar, but still it's going to harm you. So cut down your sugar intake, right? Even if you take honey in a good amount of honey, it's going to harm you as well. If you take the jaggery, still it's going to harm you, but as compared to the table refined sugar, less. So alternatively, if you want to cut down your table sugar, replace it with jaggery, replace it with honey, but still you try to minimize the amount of that you take. But don't worry about the sugar that is coming from your fruits, that is coming from vegetable, because that is healthy sugar. It's not going to increase your blood sugar so high and bring it down so low. That is what you might have heard, insulin spike. What is insulin spike? You take a lot of sugar, blood sugar increases very high. In order to combat that, large amount of insulin has been released. So you can see, if you plot the graph of insulin, it will go up very up, come down very slowly, right? So that is the reason you don't want to take this kind of sugar. Again, covering about this topic again, sugar and diabetes, there is no direct relationship. It's like indirect, okay? There is indirect relationship between sugar and diabetes. But if you are having diabetes, then no, big no. But if you're not having diabetes mellitus, please, I would like to request you, try to minimize it as much as possible, right? As you know, nowadays, now this whole pandemic is going on. Now if they are saying, if you're having comorbidities, that you have not taken vaccinations, you have having uncontrolled hypertension, uncontrolled diabetes mellitus, you are immunosuppressed patient, you're taking some cancer therapy, you're taking some oral corticosteroids for some autoimmune disease, you're in high risk. So why to put yourself in high risk? Diabetes mellitus itself will put you in high risk, because lot of sugar is present in your bloodstreams. More amount of sugar is a very good medium to this thing for organisms to grow. That's why you can see a lot of infection in people who are having sugar. That's why if person is having a gangrene in his toe, the nerves are damaged, he won't understand, okay, the nerves are damaged, he won't understand the pain, he won't give attention to it. Second thing is that the blood vessels are compromised, so there is no adequate blood going to it, so no nutrition is going, so it is not healing as properly, right? And third, high amount of sugar, that means the bacteria can grow very easily. So these are the reasons you want to avoid diabetes as much as possible. And please talk to your doctor about how to combat diabetes, and do regular checkups and take your medication as prescribed by your doctor. Thanks, Sona. I'll see you around.